Welcome back to sqadia.com. The topic we are going to discuss today is foot or ankle pain. It feels like aching or burning pain in the foot or ankle. Certain activities, such as walking, standing, or wearing shoes, can make it worse. On your patient visit, you will ask him about joint pain, foot numbness, any previous x-rays or evaluations of the foot and ankle. You will want to know if he or anyone in his family has had any of these conditions like gout, alcoholism, pernicious anemia, diabetes, rheumatoid arthritis. You will want to know exactly where he feels pain and if he experienced a recent injury to his foot or ankle. You will want to know if he is taking any of these medications, like gout medications such as colchicines, allopurinol, xylopram, or probnicid, Benamid, or the tuberculosis drug isoniazid. You will do a physical examination including the following: a test of his nerves and movement, thorough foot and ankle exam, including checking for bone deformities, pain, swelling, range of motion, and pain on movement or weight bearing. If a patient comes to you with typical symptoms like foot pain, sometimes calluses, may occur after a change in occupation, shoes, or activity. He might be suffering from foot strain, which is sore feet following certain activities. If a patient comes to you with typical symptoms like foot pain or pain in other joints, he might be suffering from rheumatoid arthritis, which is autoimmune disease that causes joint problems. If a patient comes to you with typical symptoms like ankle pain, tenderness, swelling in the ankle, history of twisting the ankle, he might be suffering from ankle sprain, which is injury to ankle. If a patient comes to you with typical symptoms like ankle pain, deformity, instability in the joints, the patient might be suffering from ankle fracture, which is a break in one of the ankle bones. If a patient comes to you with typical symptoms like heel pain, aching, or pain after stress, tenderness in the ball of the heel, the patient might be suffering from fasciitis, which is inflammation in heel tissue. If a patient comes to you with typical symptoms like heel pain, tenderness, and swelling in the Achilles tendon, the patient might be suffering from Achilles tendinitis or bursitis, which is inflammation of the Achilles tendon or lubricating sac near a joint. If a patient comes to you with typical symptoms like pain in the heel and midfoot, more common in children between the ages of 4 and 14, may occur after injury. The patient might be suffering from osteochondritis, which is inflammation of the bone and cartilage. If a patient comes to you with typical symptoms like burning pain, pain worsens when squeezing the front foot. The patient might be suffering from neuroma, which is abnormal, unchecked growth of cells from a nerve. If a patient comes to you with typical symptoms like chronic pain in the big toe, hurts with each step, he might be suffering from degenerative arthritis, which is joint inflammation. On the same symptoms, he might also be suffering from stiff toe, which is stiffness in the big toe. He may also have bunion, which is swelling in big toe joint. If a patient comes to you with typical symptoms like joint pain, more common in men over 40 years old, acute and recurrent pain at the base of the big toe, sometimes pain in other joints, the patient might be suffering from gout. If a patient comes to you with typical symptoms like sensation of burning or pins and needles, decreased feeling in the foot, more common in people with diabetes and alcoholism, the patient might be suffering from neuropathy, which is disease of the nerves. So that was all for today. Keep following sqadia.com for more such videos.